Good evening and welcome to Blueprint Explosive Exclusive. I'm Madhavdas G. Viewers, the Aadmi party has projected its Delhi model as an example with others should emulate. But now there are glaring lapses coming to the fore in this much touted health model of Arvind Kejriwal. From unspent COVID funds to basic amenities missing in Mohalla clinics, CATs, ambulances lacking essential equipment. The list of irregularities is long, and all this has been revealed in the CAG draft report on Delhi's health infrastructure, which Times Now has accessed. Over the next half hour, we will take you through some of these startling revelations from this report. But first up, let's begin with the Mohalla clinic and look at what the draft CAG report really says. Of these Mohalla clinics, at least 21 were found without any toilets. Moving on, there are 10 Mohalla clinics without any drinking water for the patients who are present over there. There are 24 Mohalla clinics where there is no AC facility to store the drugs. What would happen to those drugs which are not stored in AC facilities remains to be seen. In 24 of the Mohalla clinics, medicines found lying in the open, says the CAG draft report. In 16 Mohalla clinics, there is no power backup at all, is what is being stated. In 29 Mohalla clinics, there's no fire extinguisher, which is of course a basic safety procedure, which is of course required. This is as far as the lapses found in Mohalla clinics are concerned. And of course, there are several other aspects that we're talking about. This is of course the most prized really statement or the prized announcement or scheme as far as health is concerned, as far as Mohalla clinics are concerned. But this is not all. There are other findings on Mohalla clinics as well. In 18 Mohalla clinics, there is no thermometer. 45 Mohalla clinics has no X-ray viewer. So what happens if you have a fracture in X-ray and go there remains to be seen. There is no pulse oximeter in 21 Mohalla clinics. This is as far a basic requirement which would be there. No 12 Mohalla clinics which have no weighing machine, for instance, and 11 Mohalla clinics with no BP apparatus. In fact, a BP machine is something that is quite basic and is found, in fact, even in residences nowadays, particularly with those who have such chronic problems related to blood pressure. But that was not present in at least 11 Mohalla clinics, is what the draft CAG report is saying as far as this particular scheme, which has been much touted by the Aadmi party. Let's go across to Teshri, who's accessed the draft CAG report. Teshri, in this draft report, Teshri, it very clearly says that several such lapses in the Mohalla clinics, basic amenities that were missing, which leads many to ask, while it might not be a super speciality, healthcare facility, such basic aspects such as thermometers, such as BP machines, such as weighing machines are a very, very regular feature which any basic dispensary should be, in fact, possessing.
Well, absolutely. And in fact, remember that Aadmi party government had always portrayed themselves as the best in health model, and something coming out of like this in this particular draft CAG report is certainly very much surprising, because remember that during campaigning also and in their manifesto also, Aadmi party had been very much more vocal about their health model, not only about health model, but also they have talked about how Mohalla clinics were functioning and in fact providing free services to the people of Delhi. And in fact, the kind of details that we have been managed to access by our sources about this particular draft CAG report that highlights that how poor conditions of the Mohalla clinic was, not just the Mohalla clinics but the hospitals also that came under Delhi government, they were also running in the poor conditions, lack of facilities, lack of beds, lack of infrastructure, lack of doctors. The team of doctors was also in fact not sufficient to treat the patients. And in fact, in the graphics also we saw that how the basic requirements such as thermometers, stethoscope and whatnot, all these things were missing from the Mohalla clinics. And in fact, from the ambulances also, the important things were missing. What an ambulance should have, the ventilator machine that an ambulance should have, not just that, but
we'll go across to the CATs ambulances as well. We will also of course discuss what happened at the time of COVID, because remember that this is one of the biggest healthcare crises that the country and the world indeed has witnessed. But what was happening in the national capital as far as these distressing scenes are concerned? The Delhi government failed to utilize the large chunk of the funds sent by the central government under the COVID emergency response plan. Additionally, in fact, the funds that was meant for the health infrastructure got lapsed from 2016 to 2021. Take a look at this. The government of India released about 787.91 crores. What was spent was 542 crores. The unspent money was a whopping 245 crores, says the draft CAG report, as far as this particular amount is concerned. Also, of course, looking at the various years where this money is there, let's quickly bring out the next set of graphics with the details of the year by year, in fact, amount that was allocated. In fact, in 2016 to 17, this is the Health Infrastructure Fund that got lapsed. This is what the CAG report has detailed. It was 288.45 crores. In 2017-18, it's 282, in fact, 0.428 crores. It goes up to 553.76 crores, comes down to 497.25 crores, 466.92 crores, and comes down to 191.48 crores. Tejasvi, a total amount of about 2,632 crores is what we are talking about. Is this entirely the amount that has been lapsed, or is this the total allocation? Explain this to our viewers.
That's the total amount that's lapsed, and in fact remember that now Aam Aadmi Party is certainly responsible so as to what has happened to this particular amount, because remember that these data that we have managed to access from the draft CAG report, it also highlights that what was the estimated cost, what was the amount used, and in fact not just that, but also if you see as far as the COVID time is concerned, that was at the peak time in their 2021, Center had allocated funds to the Delhi government, and not just the Delhi government but to each state. But as far as the Delhi government is concerned, then yes, regarding the COVID funds, the funds were in fact given to the Delhi government, but the funds were not utilized. The funds were given in several sections, and categorically the funds were distributed, but the funds were not utilized. Now the question remains that if the funds were not utilized, if it is if they are not utilized, then where the money has gone, where the money has been utilized, because this particular money belongs to the taxpayer of Delhi, belongs to the Aam Aadmi Party, belongs to Aam Aadmi, and in fact Aam Aadmi Party is certainly answerable so as to where the funds have gone.
All right. In fact, stay with us, Tejasvi, because this is the last aspect. In fact, there are multiple aspects of this draft report. We are just bringing you some of the big and glaring highlights. And one of the other highlights is that a scheme which is meant to save lives of those under medical emergency, and that is the CAG scheme. It's a free ambulance service of the Delhi government, which has sought to decrease the response time in such emergencies, is also found to be missing essential equipment. What is the equipment? Let's take a look. Cardiac monitors missing inside the CAG's ambulances. Transport ventilators, which are so crucial in saving lives. Syringe pumps, which also, of course, were not present in these CAG's ambulances, says the draft CAG report. This is, of course, some of the many essential equipments that are there. Let's also look at some of the hospitals. This is the Indira Gandhi Hospital, where the delay in the construction completion is over 5 years. The increase from the tendered cost to the final cost is over 314.9 crore rupees. The Burari Hospital, where there is a delay in construction completion, is 6 years. Here, you see an increase or an escalation in the cost of 41.26 crores. The MA Dental Phase 2, a delay of 3 years, which has cost 26.36 crores. And this is, of course, just some of the hospitals that we're talking about. There are much more details in terms of what this means, but two very important aspects. A, on the one hand, you see lapse funds. On the other hand, you see cost escalation and basic emergency features such as CAG's ambulances, Tejasvi, that are missing their equipment.
Absolutely, the basic facilities are missing, and in fact, as we saw that the ambulances did not have even ventilators, wheelchairs, thermometers, oximeter. These are all the things that were missing from the ambulance itself. So if this is the condition in the ambulances, so we can imagine that what will be the conditions in the hospitals where thousands of patients go to treat themselves, but then the doctors are very less. Sometimes the doctors are missing, sometimes the equipments are missing, sometimes the infrastructure is missing. And in fact, if we talk about this particular tendering cost, then if we talk about tenders, then this is not something new that we are witnessing, that the huge amount of tenders have been given to the private entities, and in fact that's why we highlighted earlier also in our exclusive news breaks that how Aam Aadmi Party ministers have given deliberately tenders to those entities who will benefit them in an indirect way. So that is why all these hospitals, in fact, that we have named, these are just few hospitals that in fact witnessed delay also in construction.
Tejasvi, thanks so much for bringing us that exclusive breaking update there. We'll keep coming back to you for more updates as well. Thank you so much for breaking that big story here on Times Now. Let's quickly turn focus and take it across to our guest joining us. With us is Neoma Gupta, who's a BJP spokesperson. Joining us also is Raghav Awasthi, who's a lawyer and a political analyst. With us is Advocate Amol Pawar, spokesperson of Aam Aadmi Party, and Hakeem Rizwan Ilahi is a political analyst with us. Advocate Amol Pawar, I will just ask you first and foremost about the Mohalla clinic. So much was spoken about it. The Aam Aadmi Party literally had it as a jewel in its crown as far as its developmental activities is concerned. But just look at what the draft CAG report says. Basic facilities like thermometers, like stethoscopes, weighing machines, X-ray viewers, all missing in a large number of such Mohalla clinics. What is the standard of healthcare that was being provided to Delhi citizens, sir?
Madhavji, good evening. This is a draft CAG report. Let it be tabled in the House. Yesterday, and in fact, we have been debating this for the last 2 or 3 months, that this corruption, in the so-called liquor scam, that the Exchequer has beared a loss of thousands of crores. But today we have seen that when the excise report was presented in the House, it in fact exposed the flaws and corruption in the old excise policy, which allowed illegal liquor smuggling from Haryana and Uttar Pradesh. And this report, in fact, validates our stand. ये तो हम पिछले 2 साल से कहते आ रहे थे that this excise, the old excise policy, is not good for the people of Delhi. That is why we introduced this new policy, which is in fact being implemented in Punjab, which has in fact it has increase the revenue from 6,000 crores to 10,000
Well,
crores.
Mr. Pawar, in which case
years.
the government of Delhi should not have cancelled the new liquor policy if it was such a good policy. And of course, there are very glaring lapses in the liquor policy that have also been pointed out. But let's not digress from what we are reporting right now. We're talking about a CAG report. Would you like to say something about the kind of lapsed funds to the tune of 2,600 crores, whereas there is cost escalation in other hospitals? How do you explain that? Because here you have funds that are unutilized. On the other hand, you have cost escalation happening due to delayed projects.
Madhavji, in the last 10 years, we have opened 530 new Mohalla clinics. And in fact, 28 new hospitals are on the verge of completion. And that is the report before the Honorable High Court. And it is by the amicus curiae who submitted that report. So ऐसा नहीं है कि कुछ काम नहीं हुआ. The reality is
काम हुआ लेकिन डिले हुआ सर, वही तो बात है. काम में बहुत डिले हुई. क्वालिटी ऑफ वर्क की बात है. 11 साल थे आपके पास, 10 साल से ऊपर थे आपके पास, लेकिन the quality of work that the people of Delhi could have received has not been there. Anyway, let's bring in others. Let's bring in Neoma Gupta. Neoma Gupta, your response. Work has happened. It is wrong to say that no work happened under us. There are Mohalla clinics, over 500 that were brought in. There were various hospitals built. But what's being discussed here is the quality of healthcare that was provided to the citizens of Delhi. Neoma Gupta.
Good evening, Madhav sir, and all to the rest of my panelists. Honestly speaking, we are not privy to this CAG report, so it's come as shocking news to me. It's breaking news, but it's also shocking news to see, I mean, how pathetic the health system was under the Aam Aadmi Party government. And I would like to comment way more once this is stable and you can actually get information to really push them against the ranks, because from what information you've shared on the TV right now, I don't even know how these clinics were operating. I mean, were they making a mockery of the health of an Aam Aadmi person who was going over there? This seems to be rather tragic. So it has to be tabled before I can comment on this. And when it comes to Amol sir, I mean, I just have to say in the liquor thing, from ideation to implementation, everything about the new policy was badly thought of, with intent that it was clearly unethical to Delhi's financial interest. I mean, today we are learning about a massive revenue loss of 2,002 crores. Okay, then the failure to enforce Rule 35 of Delhi excise.
Right.
It's an endless.
I don't want to take away from Tejshri's report on healthcare. Please, let's not diverge. I've requested Amol as well as I'm requesting you, Neoma. Let's not take away from the seriousness, because we're talking about the lives of the citizens of Delhi. A lot that was promised in terms of these Mohalla clinics. And I want to bring in Hakeem, Rizwan, Ilahi. Just look at this. How can you have CAG ambulances, sir, without basics such as wheelchairs, such as machines, such as ventilators, which are so essential to such emergency services? Because these are really life-saving equipments, Mr. Ilahi, which any modern city should have, least of all our national capital.
No, first of all, what I would like to say is what Aam Aadmi Party did is something unprecedented, which we have never seen in any other parts of India, something done by the government. And there might be some instances where there might have been shortcomings. There might have been instances where there might have been shortcoming, but we cannot, budge from this particular significance that Aam Aadmi Party worked. It created Mohalla clinics for the downtrodden people of India, which no other government in the history of Indian politics has done so far. And talking about the CAG report, basically, which, everybody, it has been a hot topic, what BJP actually portrayed all over. They created a narrative where they said that Aam Aadmi Party have been, into malpractices and corruption. But as we all know, the CAG report says that the new liquor policy would have created much more revenue.
Sir, we are
for
not
the Delhi
discussing
government.
liquor policy, we're discussing healthcare,
And
we're
this is
discussing
the
the lack of facilities
truth
at
today.
Mohalla clinics, we're discussing cost escalation
I
and
got
construction
it,
of
I got
hospitals,
it.
we're discussing
But there are
unused funds to the
thousands
tune
and
of
lakhs of people.
2,600
That is
crore
why-
rupees over a 7-year period. And this is rather unprecedented.
Sir,
at least
let
you
me
were-
speak.
Yeah, please
You have
speak on
called
the
me
healthcare
this.
policy,
Let
sir.
me speak. I told you there might have been. See, first of all our ministers, Satinder Jain ji, who was a health minister who created these Mohalla clinics, it was the brainchild of Satinder Jain ji. He was put behind bars, and this is the policy. This is the policy of vendetta politics.
So what?
This is
So
how
is it?
BJP
But
wanted
what
to
does the
portray.
quality
And yes,
of the
course,
services
if
have
you
to
are
do?
keeping-
Let me read out some other
if you are-
service shortfalls from the draft
Sir,
CAG
that's what-
report.
that's-
Out of 27 hospitals, ICU services not available in 14. Blood bank services not available in 16. Oxygen services not available in 8. Mortuary services not available in 15. Ambulance services not available in 12 hospitals.
what
49
I-
instances
that's-
where calls were refused by
that's-
Delhi
that's what
government
I'm saying.
ambulances in
That's
February
what I'm
2020.
saying.
This is all part of the draft
That's what
CAG report, sir.
I'm saying,
So
if
sad.
CC, I'll tell you one thing. Bharatiya Janata Party put behind bars all our leaders, including Satinder Jain ji, who was a health minister. And you kept, Bharatiya Janata Party.
Sir, who
kept
was
them,
behind bars in February
behind the
2020?
bars
Please
for-
tell me.
For more than a year.
Who was behind bars in February 2020? This is from February
And
2020. Tell me.
My question is, I agree with this. Okay, there might have been shortcomings. What was LG doing there?
Okay, what was LG doing?
his role?
Raghav Avasthi. What was
Why
LG
don't
doing?
anybody
Our
question
ministers
him?
were
He
jailed.
was also-
Therefore, quality of services
he was
were not
also
there.
sitting there.
What
What
was
was
the Lieutenant Governor doing? Who in fact has a role to play in Delhi's governance? Your response, Raghav.
I think as far as the Lieutenant Governor is
Yes, why
concerned,
not?
we need to first understand the structure of governance in Delhi. There is, of course, the GNCTD Act and there is Article 239AA of the Constitution. So there are certain subjects with respect to which the Lieutenant Governor is not duty bound to act on the aid and advice of the Council of Ministers. And that includes inter alia, land, law and order, etc., which, of course, if it was a governor of a normal state, he would be bound to act on such aid and advice. But on subjects like health, it is the elected government of Delhi that has all the powers. And the Lieutenant Governor is bound to act on the aid and advice of the Chief Minister and his Council of Ministers, of course. Now, the political issue is this. The Aam Aadmi Party had been tom-tomming their achievements in the field of health. And now the reality has come out. The Comptroller and Auditor General, which is a constitutional body, is now flagging all of these deficiencies in their flagships. So I think it's high time that the truth
Right.
should come out. And now that these people are out of power and cannot indulge in political grandstanding beyond a certain extent.
Well, what we have accessed is a draft CAG report. Perhaps in a few days, the final report would be out in the public domain. It's going to be tabled in the assembly. The government has promised that all the 14 CAG reports will be tabled in the assembly. We've already seen one as far as the alleged Liquorgate scam that has already been tabled today. Others, of course, expected, and that's when we will know exactly what the truth of the entire matter is. But there are certainly very, very serious questions as far as governance during the past 10 years of Aam Aadmi Party rule are concerned. And we will, of course, have to see what finally the CAG has to say on this matter. I'd like to thank all our panelists, Hakeem Rizwan Ilahi, as well as Advocate Anmol Pawar, Raghav Avasthi, as well as Niyoma Gupta. Thank you so much for joining us this evening.